public comments because of the not being on the agenda. You need to be 2 weeks notice in order to be on our agenda, so I apologize for that. So we did add one item to the agenda that's so that the commissioners could be with us. I hope you can hear me okay. I know it's hard. Just took a mask on. We really do appreciate you, and we're glad that you're here, and we'll be interested in hearing any comments that you have to make. I want to personally thank all the members of the health department employees and our director for all the work that's being done here through this crisis. And we want to try to continue to keep everybody as safe as possible so that we can maintain the health of our community. So, anyway, a brief synopsis. Is everybody still here okay?
Mr. Sheever, can you hear us?
Sorry.
Yes, I can. Thank you.
All right, you're welcome.
Now, Mary Jo is going to make some comments now.
Yes, I just wanted to give some points to the board and the commission, kind of where we are right now. So the extension of the stay-at-home order for Platte County that was issued on May 15th, or till May 15th, was determined utilizing a model called the Institute of Health Metrics and Evaluation. And that projected the COVID-19 peak in Missouri and Kansas to be April 28th. So a group of 9 public health directors from Kansas and Missouri and the Kansas City Metro determined the extension date should include a 2-week period or the incubation period for COVID beyond that peak. We all agreed that that date would be a fluid timeline while observing our case counts and trends to see if the date needed to be adjusted. Then on Sunday, April 19th, that same model was modified, moving the peak predicted for our area from April 28th to April 17th due to the newest data collected on hospitalization rates, deaths, and then they also tracked social distancing compliance with our stay-at-home orders by our cell phones. So that all played into the Institute for Health changing that model. So as we stated throughout this whole thing, the novel coronavirus, has just caused us to have changes every day and new discoveries about the virus. So it's all a very fluid process. And you all are aware, but I need to say this, that throughout the nation, testing has been woefully inadequate. So even our reported numbers are not accurate gauge of the cases that are present in our county. The dates on the graphs that we all are looking at from the MARC website or our website, I just want to fill you in on what those are. That is the dates that we received the lab reports, not the dates that people became ill. And just for information, the average time from onset of illness until we get the positive lab report is 12 days. That's the average, from when you get sick until we get the results. And I know I mentioned the MARC graph. Some people have communicated with me that the MARC website, that it appears that we reached a peak on April 6th in the Kansas City area. Well, I want to give you a little information about that because in actuality, the number of cases that were reported on April 6th is inflated, so to speak, but that's because 2 of our big health departments, they do not report cases over the weekend. So April 6th was a Monday, so they don't report cases over the weekend, and then those cases get logged on that April 6th date. So technically, the highest number of cases reported in the Kansas City Metro was April 10th, but 107 cases. And then as far as just Platte County, our cases have flattened over the last 7 days. So it appears that we may have had our peak on April 10th as well, as I just said. So as I stated at the beginning, we are continuing to monitor our case counts to assure that those case counts stay low. So that's good news for Platte County. And then we'll be looking at our stay-at-home order to see if we can move that up to an earlier time, but only if those cases stay down. And at this time, I am building a task force to assist with plans to begin to slowly phase in the reopening of the county be on it. We would like an emergency manager. I'd like someone from the faith community, school representatives, and business representatives, of course, to be on there with us so that we can, kind of develop the details of that plan together. And finally, I just am happy to report that we began COVID-19 testing today at our Parkville facility for Platte County residents only. And this is a huge collaborative effort between us and the University of Kansas Health System, where we can offer free testing to residents who complete a symptom reporting tool on our website. And then they'll be reviewed by one of our nurses, and then that individual will be given an invitation to come for testing if they meet our criteria. And the really good news for that is KU has done a great job. Their turnaround time for this testing, they say they're hopefully optimistic that it will be 24 to 48 hours on that turnaround time. So that's great. And I just want to give a little shout out. The testing supplies, the laboratory equipment, and the processing of the test were made possible by a huge donation from a group of business leaders. And they are known as the Kansas City COVID-19 Task Force. That's Nathaniel Hagedorn, CEO of the North Point Development, Tyler Notberg, CEO of U.S. Engineering, Dave Cummings, CEO of TradeBot, Andy Deister, CEO of Russell Stover's Candy, and Ty Mornana, CEO of MTAR LLC. So we thank them very much for this capability because, as I said earlier, our testing capability has not at all been what we need to determine the actual case count in our county. So we appreciate their help with that. So that's all I have.
Okay.
So, Commissioners?
This time you guys want to talk and have some comments you'd like to make? Any questions of us?
Were you asking after we had questions?
Yes.
Oh, very good. I missed that.
Yeah, sorry.
Comments?
Thank Mary Jo and your board for allowing us to join the meeting tonight. We're all very concerned about making sure that the vulnerable get services, and we are protecting those. We're also very concerned about what's happening in our families and in our communities. So I appreciate this opportunity to have a good exchange of information and ideas. You mentioned that you've been locally, the testing capability's been locally, I can't remember, locally under what? It was test?
Yes.
Okay. Now that you've got this additional testing capabilities, can you, I guess I'm looking for some assurance that we're going to have additional testing, which I assume will then show that we have more cases. How is that going to be taken into account as to whether we peak? Because we're testing more and we're uncovering more cases, that doesn't necessarily mean that we haven't peaked. Is there a model or what are you guys going to be doing to determine if we peaked on April 10th now that we're doing the additional testing?
Yes, we've talked about that, and it's just a matter we're going to have to, take all of that into consideration as we look forward, Commissioner. It's all new territory that we're all dealing with this, and there's several other health departments. We're not the only one, of course, in the Kansas City area that are doing this, and all of us health directors in the Metro S9, Kansas and Missouri, will be talking through all of this, on a weekly basis. So as we assess all that.
But I guess the determination won't be made just based on, well, we've got X number of cases now, which is an increase, because the increased testing in and of itself should show an increase, right?
Sure. It should result in some positive cases. So, they'll also be looking at hospitalization rates, our death rate. Thank goodness, we have had no deaths in Platte County. We stand at 60 cases in Platte County, Kansas City, Platte County, and Platte County, not Kansas City, as of today.
And I do appreciate the transition task force. I'm very excited about that. Commissioner Wood, thank you for agreeing to volunteer. I think the makeup of that
a pretty good inventory of PPE here, and Daniel Hagedorn also today sent me an email. God bless him, that he has several hundred KN95 masks that have not been recalled, and I think 1,500 surgical masks. So that's for all first responders in Platte County, along with the health department. So that helps, as far as that goes, tremendously. But just educating.
What could we provide to them or do for them to get them back out in the community? If you have an unlimited budget or not much of a limit on budget.
That's a wonderful question that I would like to have some time to give some thought to.
Okay.
The antibody testing, of course, would be awesome, because that will tell us who has immunity, and that's something that our medical director, Dr. Phyllis Parker, is doing some checking on that. So, but I'll do some more research, and I appreciate, your question, and we'll get back to you on that.
Well, I want to give you the reason for my question, and to John and Dagmar, I apologize that I haven't been able to talk to you about this, but this is our first posted meeting. I had a conversation earlier today with our state treasurer, who's going to be responsible for distributing the CARE funds, and there is going to be some very specific funding available that will be distributed by the county. And so I would like, in addition to the task force coming up with the transition plan, I would like maybe that same task force to take on looking at how to best utilize those funds. And I understand that there's going to be a lot of people out there wanting to get those funds. For me, I believe we need to make sure that we allocate those funds to make sure that people who have been impacted by this directly because they've had a family member or they've had direct COVID-19 exposure, and two, the fastest way for our community to recover from this, I believe, is to get our businesses back to work. And I believe if there are things we can do from a health standpoint to help our citizens do that safely, but we just don't have the funding, maybe these funds should be allocated for those types of purposes. I'm going to give you the unofficial terms that I got today. And again, John and Dagmar, I apologize that I haven't had a chance to talk to you guys about this, but literally just had to call with the treasurer today. So the total relief funds in the United States on this first wave is going to be $2.1 billion. Both Jackson County and St. Louis County are going to be direct recipients of a pro rata share of Missouri's, Jackson County and St. Louis County are going to be direct recipients, or the only direct recipients of funds from the federal government. There will be an additional $520 million that will be distributed to counties based on population. So they'll take out the Jackson County, they'll take out the St. Louis County because they're getting their funds directly. There's going to be $520 million to counties based on population. Based on the current 2019 estimates of population, Platte County would be getting approximately a little over $12 million. Of that $12 million, the treasurer's office asked me
health officer, I need to watch to make sure that our counts stay low, for that 2-week period. So if our peak truly was on the 10th, we need to kind of watch and make sure that our count stays down, even with our expanded testing. I get that. Watch our hospitalization, data, that hospitalization rates and deaths, as long as those stay, where we are right now. I think, it would be prudent to look at moving that date up. But it's like trying to predict history. This is all that hindsight that we've all talked about in our life. You have to wait till you can review it in the rearview mirror, so to speak, to make sure. Because we don't. I put that out in a press release a couple days ago that what we don't want is to release too early and then have a huge spike in cases and a huge spike in hospitalizations, and then have to lock back down for longer. So that's a tricky balancing act to do, but I'm sure going to keep our eyes and ears open to all of this so that we can, make the safest and best decision for our county citizens, and as Commissioner Shieber said, make sure that we get people back to work when it's safe. So.
And I appreciate that. I don't want to push states or anything like that, but I'm really encouraged that you're considering that, and that our new cases are staying flat and decreasing. So, and I just to be clear, if hypothetically the health department decides to pull back on that date, would it still be permissible if there was a municipality in Platte County, who's not in whatever, but if there was another municipality that wanted to go out and continue to have restrictions, could they enact restrictions if they so chose to do so?
You were breaking up a lot during that, so I'm not sure I understood your question. Like, are you talking about our separation of Kansas City and Platte County within the Platte County borders? If Kansas City decides to do something different?
Actually, no, I was wondering if there was another municipality, I don't know if you can hear me better now, if there's another municipality within Platte County, not necessarily Kansas City, but if there was another mayor who decided that they wanted, if you hypothetically pull back on your date and they wanted to enact some restrictions that were more restrictive, would that be permissible?
That's a go ahead and just move forward with advertising for the RFQ for the architect. Just, during this time, I think it'd be a good time to just keep moving on, and get our architect advertised for, and we review those as they come in. Maybe it's the next board meeting even, or is it, if that's enough time, and we'll just move forward with our building.
There's a motion for that.
Yes, please.
I'd like a motion to move ahead with advertising for the architect RFQ.
I move we advertise for our architect RFQ.
Second? Okay. Any other discussion? All in favor? Aye.
Okay. Thank you very much. We need some positive news here during this time. So,
Okay. Word from the director?
well, I think you've heard about what I've been doing for the most part is dealing with the COVID. So that's just the main thing. Our staff have been doing some e-health visits in the family health care clinic to the tune of 73 for the past month. So that's pretty good, considering what's all going on. And clinic has been, shut down for, of course, vaccination services. All health departments are. We have been doing some STD testing, and I don't think all health departments are doing that, but I'm happy the nurses are doing that, and then now the nurses on a daily basis will be doing the testing. So right now, with demand being low, we are going to be doing it 2 hours a day. We did it 10 to noon today, but it'll be 9 to 11 for the most part. So
How many we do that?
probably stealing Angela's thunder, but I believe we did 13 today, and there's 12 that have filled out the symptom reporting tool, maybe more, for tomorrow. So that's good. Yeah, good.
We're actually in over 40.
Oh, over 40. Oh, my.
Big influx today.
Wonderful.
We're getting out of the
Well, no, I just did,
There is a,
I filled it out, but I didn't submit it. I just wanted to see what all it said.
That's good, too.
So I filled it out, but I didn't submit it.
Yeah. So that's about it for me. We kind of talked about this. We knew that this meeting would be a short one because pretty much all we've been doing is dealing with the COVID, and that's enough right now. So yes, ma'am.
Can I ask a question? I hate to drag you back to COVID, but I'm going to. I've been, I serve on the Tennessee Health Commission, so I get a double shot of of this stuff. But I've been doing a lot of looking at the plan that has most recently come out of the White House. I don't know if you're familiar with it or not, but it's the three-phase plan.
Yes.
And it's actually pretty sound. And I think it is driven by the medical experts and the epidemiologists
contact tracing. Aaron and Jordan have been able to handle what we've had so far. And then we've brought another former employee, actually, Julia Adams, used to do communicable disease investigation here. We've brought her back PRN to be able to help with that. And we'll possibly, try to get others. The Sheriff's Department made us aware that the Medical Reserve Corps have several people from that in the Kansas City area have offered their time. So, if there's some nurses that could help with the contact tracing, that'd be awesome. I do know that, I believe it's Wyandotte County, they are using 40 medical students, to assist them. They've got them all positioned. So, that's a huge thing. And hopefully, since we've had a stay-at-home order in place, people that are positive won't have had a lot of contact, so you won't have a lot of people to call. And that's really what Erin's kind of found out when she's been doing the contact tracing, is they're like, I really haven't gone anywhere. So I know you're relying on everybody's honesty, but that's all we have to go on. So, but anyway, yes, I have, looked at those documents briefly, need to dig in much further, and kind of finish selecting who I'd like to invite to be on this task force as well. So.
Mayor Joe, may I interject kind of along with what Paula was saying? I too read that policy, the 3 steps, and I did like it as well. I spent several hours today on the phone with medical providers, actual doctors that are all privately owned, by the way, not part of a big medical system. So this has impacted them financially, just to kind of get their opinion as to everything going on and what their thoughts are, what they're seeing in the healthcare industry, both Platte and Clay counties, and both reiterated the same thing. Number one was that no one was prepared. PPE and the testing everywhere in the nation wants all that. That was a universal thing. I think that that's starting to come around, but it's just not starting. With that, like you said, it's an influx of positives. And the other area that you can look at are all of our healthcare facilities, our hospitals. Are they equipped? What are their systems like in place? Are they currently overloaded, or do they have the ability, if we open these up, to accept that increase in patients and increase in positive cases that could come to them? Do they have respirators, have the equipment in place at those facilities, or are we going to cause an overload like what happened in New York? And that's the other area they suggested that we look at, is the actual facility and what their capabilities are and where they're at. I know the one told me at Liberty Hospital has only seen probably 4 or 5 cases and 1 death, and that they would be okay. But the other 2 hospitals north may or may not. They didn't know, and none of the providers I talked to could tell me those numbers because they weren't owned by the hospital. So you don't get those numbers. But that's what their worry was. Most of them finally this week or the end of last week got their PPE for their own staff and testing supplies to be able to swab patients and send them to the lab. And that's just now getting in place in the healthcare provider settings, just like the health department. But that was kind of a universal statement from all of them. And then the other area they said that should be helping us is with history, warmer weather. They don't know that and they can't prove it, but the warmer weather tends to decrease the amount of virus spread. So I just wanted to share what I found, and I did spend several hours on the phone with different doctors today from the healthcare field and what their thoughts were.
Well, I do know, thank you for that, Kathy. I do know that I've been on a couple of these calls. I could spend pretty much all day on calls, with different groups, but I've been on a call with the Missouri Hospital Association and health departments, and they are monitoring that, all those counts that you were just talking about, ventilators, respirators, PPE, and, all the hospitals thus far have reported that they have adequate supplies. And like you just stated, they really haven't been overrun with a lot of hospitalized cases. And on these calls, they report how many admissions they've had, how many, have needed to masks, and they've been sitting in very nice dry storage, waiting to be used. So we haven't had any, we haven't ordered any PPE actually. And then, like I said, Nathaniel Hagedorn sent me an email today, and we'll be deploying a staff member tomorrow to go pick it up at a warehouse over in Johnson County. So he's from Platte County, and I think I told the board he's communicated with me, and he wants to help us in Platte County to be ready. So we really appreciate that. So that's one. Make sure you have PPE. Make sure you have the ability to do your contact tracing if and when there is a spike. I've already mentioned that to the board, and then, we develop a plan to, how we're going to start opening up businesses. And I think it'll be good to have we can't have a task force of 100 people, but, to have a variety of businesses, some food establishments, definitely schools, things like that, so that we can hear from them, how this is going to impact them, what their specific needs or challenges or questions would be. I've already got questions from churches, today, so I just think that's all part of that plan. So
I just was worried that getting all that together is going to take 2 months. How long is it going to take to get everybody together?
the task force, you mean? Well, I think everybody's pretty eager. Yeah, I think.
So if we're trying to, we need to be getting it together right away then.
Yes, well, that's why I've asked Dr. Parker if she would be on it. Aaron, I think it needs to be on it for sure. Commissioner Wood has autograph in the parking lot. Would that be okay?
I have to get groceries tomorrow, I'm out of food.
Okay, all right.
That's great.
It's a date.
That happens.
We need a motion, move out of regular meeting into executive session.
Yeah, I